Thank you for choosing Spartanburg Regional Healthcare System to assist you during such an important time in your life as having your baby. Our team of experts are here to give you the best labor and delivery care available and to help you be prepared for the day that your baby arrives. Preparing to meet your baby is the first in a two-part special delivery information series that will walk you through every step of your childbirth journey here at Spartanburg Medical Center. In this video, we will discuss a variety of preparation topics. We will go over pre-registration and prenatal class information, and we will explain what we mean when we say that Spartanburg Regional is a baby-friendly organization. Then we will look at safe sleeps, do's and don'ts, and car seat rules and regulations to keep your baby safe on the road. Next, you will get information about things you will need to plan and prepare as you get ready to meet your baby. We will help you learn about what to pack before the big day, going to the hospital, and if an emergency should arise, we want you to know what to do and where to go. We take pride in helping families be as prepared as possible for the delivery and care of their baby, and we offer several educational classes for this purpose. Many of our classes have been converted to an online format, including childbirth, infant care, and breastfeeding. You can never be too prepared for something as monumental as having a baby. So we strongly recommend that you register for our prenatal education classes online at spartanburgregional.com/prenatal. You might wonder why we are going out of our way to let you know that we are baby friendly. Hospitals and birthing centers with the baby-friendly designation have been verified by a third-party organization that holds them accountable to the highest standards for mother-baby care practices related to infant feeding. We are prepared to help you and your new baby get off to the very best start together. And we have taken special steps and implemented specific policies to help parents make informed, educated decisions about how to feed and how to care for your baby. Breastfeeding has enormous benefits for both mother and baby, and breast milk is the gold standard in infant nutrition. Breastfed babies have reduced illness, less risk of obesity, and less incidence of sudden infant death syndrome, or SIDS. Unless you or your baby requires specialized care, your baby will be placed directly on your chest after birth. This practice supports uninterrupted skin-to-skin contact between mother and baby. This special time helps with your baby's transition outside of the womb, helps to regulate baby's body temperature, facilitates mother-baby bonding, and is crucial for the first breastfeeding. Our policies allow healthy babies and their mothers to room in or stay together day and night so that they can bond and get to know each other. We offer lactation services that support you before you have your baby, while you are in the hospital, and after you go home. Our lactation clinic is on the 3rd floor of the Montgomery Tower at Spartanburg Medical Center. We offer many breastfeeding supplies in a beautiful boutique setting that can be purchased or rented. Whether you are facing specific issues with breastfeeding or just want to ensure you get off to a great start nourishing and bonding with your baby, you can schedule an appointment with one of our certified lactation consultants. In addition to in-person services, we are excited to announce the offering of lactation telehealth visits. Meet one-on-one online with a lactation consultant in the comfort of your home. Spartanburg Medical Center is a milk depot for South Carolina's milk bank. So if you have a surplus of breast milk and would like to see if you qualify as a donor, please contact us. Did you know that how and where your baby sleeps is more important than when they sleep? There are 4 simple but important steps for safe sleep. Following these guidelines for the first year of your baby's life will not only help you keep him or her safe, but the extra peace of mind may help you sleep a little more soundly too. Let's take a look at what you do and do not want to do. Do. Always lay your baby to sleep on his or her back. The phrase back to sleep has often been used to help new parents remember to lay their baby down on their back for sleeping. Do lay your baby on a firm, flat surface. Soft blankets and pillows may seem nice, but they are actually dangerous for babies. There are also important things you should not do. Do not put anything in the crib or bassinet except your baby. Avoid using crib bumpers or leave-in items like stuffed animals or blankets in your baby's bed. Share your bedroom, but not your bed. You should never attempt to sleep with your baby in your bed. However, it can often give tired parents peace of mind to put their baby's crib or bassinet close by for those nighttime feedings. Just make sure to have a chair nearby to use for feeding time as well. One of the most important things you will need to get before your baby is born is a car seat. If you do not already have one, the beginning of your 3rd trimester of pregnancy is a good time to find a car seat. Be sure to go ahead and learn how to install it correctly, because you will need it to bring your baby home from the hospital. Your baby's car seat is not just an important safety feature, it is required by law. The South Carolina Child Passenger Safety Law states that infants under 2 years old must be secured in a rear-facing car seat in the back seat of your vehicle until the child exceeds the height and weight limit of the car seat. Then your child will need to ride in a front-facing car seat in the back seat of your vehicle until they are 4 years old or outgrow the height and weight requirements of the forward-facing seat. After that, they will graduate to a booster seat and continue riding in the back seat until they are 8 years old. Spartanburg Regional offers online classes for new and expectant parents. These classes include safety topics that will help you keep your child safe and avoid accidents and injuries. The classes include information about basic car seat features, installation techniques, and how to choose an appropriate car seat based on your child's age, height, and weight. Registration is required for all classes, so visit SpartanburgRegional.com/events to sign up and learn how to protect your baby. If you have questions or need help getting or installing your car seat, call our Safe Kids coordinator at 864-560-6845. As you are planning and preparing for your baby to arrive, it is important for you to go ahead and choose a doctor's office for your baby. Don't wait until after your baby is born to make this decision. You will take your baby for a checkup just a few days after you leave the hospital, so you will want everyone to be prepared. As you consider your options, check your insurance plan to make sure the doctor's office is in network and contact the office you choose to inquire about what you need to do before your baby's first visit. Now is a good time to make arrangements for someone to take care of your other children while you are in the hospital giving birth. And don't forget to ask someone to check on your pets. It is also a good idea to make a list of names and phone numbers of the people who are anxiously awaiting the birth of your baby, so you can remember to call them right away with your happy news. As your delivery date approaches, you will want to think about what you need to pack for your hospital stay at Spartanburg Medical Center. We will provide most of the items you will need, such as a hospital gown, disposable undergarments, personal hygiene supplies, and basic toiletry items. For your baby, we will provide shirts and a hat, swaddling blankets, diapers, wipes, and any other medically necessary items. The following checklist contains additional items that you and your support person may need while you are in labor. Important documents. Bring your picture ID, health insurance card, any hospital paperwork, and your birth plan if you have written one. Labor and delivery clothes. As mentioned earlier, the hospital will provide you with a gown to use during and after labor, but you are welcome to wear your own. Feel free to pack a comfortable bathrobe, a loose nightgown with an opening in the front for breastfeeding, slippers or flip-flops, and socks. Necessities for your support person or spouse. Pack a toothbrush, pillow, snacks, and a change of clothes for the person who is accompanying you to the hospital. If you're in labor for a long time, they won't be able to go home either. Cell phone and charger. You'll likely want to stay in contact with loved ones before and after delivery, or at least enable your support person to let people know when baby has made his or her debut. Comfort items. This can include a pillow, glasses, iPad, a good book, a personal DVD player, camera, hair ties, lip moisturizer, and any other items that will help you relax. Cash and credit card. It's easy to forget your wallet during the chaos of getting to the hospital in a hurry. Baby book. If you would like the nurses to get your baby's footprints in a special book, be sure to have it with you at delivery. You will also need to bring a few things for after your baby is born. An approved and installed car seat. Call our Safe Kids coordinator at 864-560-6845 if you need assistance with car seat installation before you have your baby. A change of clothes. You are welcome to bring a change of loose, comfortable clothes if you choose not to wear our hospital gown. Clothing for your baby. You may choose to bring 1 or 2 sleepers for your baby. Breastfeeding supplies. If you are planning to breastfeed, you may want to bring a nursing pillow, nursing pads, and/or a nursing bra. Going home outfits. Pack an outfit each for you and for your baby. Remember that you will not fit into your pre-pregnancy clothes right away. So maternity clothes are the best choice for your going home outfit. Your physician will give you specific guidance about when you should come to the hospital to have your baby based on your pregnancy, the distance you live from the hospital, and your previous birth history. If you are having a cesarean section, your physician will provide additional instructions at one of your last office visits about reporting to the hospital and preparing for your procedure. If you experience an emergency related to your pregnancy, please come to the Labor and Delivery OB Emergency Department at Spartanburg Medical Center on the 2nd floor or call 911. At Spartanburg Medical Center, we are here for you before, during, and after your baby is born, and we can't wait to meet you both.